So, our topic for tonight is balanced hormones for improved energy, mood, and sleep. So, if you find that your energy has gone down, you're feeling more fatigued, your sleep is a little bit more disrupted, difficulty falling asleep or staying asleep at night, and you've definitely noticed some mood swings taking place, then your hormones might be the cause. There could be other factors coming into play, but for tonight, we're going to look at the role in terms of the hormones with respect to these different aspects of health and what can we do to feel better. So this is just a brief outline of what we'll focus on. So we'll briefly go through the role of hormones in health. We'll explore specific endocrine glands related to women's health, in particular the ovaries, adrenal glands, and the thyroid gland. And we'll talk about their relationship with one another and how we can support these endocrine glands. We'll talk briefly about what happens when we have a hormonal imbalance, and we'll really focus on the essential nutrients, herbs, lifestyle strategies that we can all incorporate for more balanced hormones and, of course, improved energy, mood, and sleep. So let's start off with understanding hormones. So what are hormones? What kind of role do they play in the body? So really, a basic definition is that our hormones are powerful chemical messengers that are produced by endocrine glands. And you can see in this diagram on the right, the different endocrine glands are listed. So in the brain, we have the pituitary gland and the hypothalamus. And throughout the body, we have other endocrine glands like the thyroid, like the adrenal glands, our kidneys, pancreas, ovaries, and others are also endocrine glands. So these endocrine glands will produce and release hormones into the bloodstream. And these hormones will travel to different parts of the body where they will bring these important messages, which will influence a number of processes that we rely on. So hormones are definitely needed for overall growth and development. They help to support our metabolism, reproduction, our blood sugar levels, our mood, and our sleep. Okay, so of course, when our hormones are in balance and everything's working great, we hope that we're have good metabolism, we're able to manage our stress appropriately, and our mood is level, etc. So we have these endocrine glands and they actually form different connections. And when it comes to women's health, of course, the most important endocrine glands are the ovaries, adrenal glands, and the thyroid gland. And of course, as mentioned, they will produce specific hormones which will help to support our overall health. Now, the ovaries, adrenals, and thyroid are influenced by the hypothalamus and the pituitary gland in the brain. So you'll see that connection in the diagram on the left. But what I really want to focus on tonight is actually the relationship between the ovaries, adrenals, and a thyroid gland. So they actually form an axis called the OAT axis, and they are actually codependent on one another. So if there's disruptions in one of these endocrine glands, then that will definitely affect the others, okay? So oftentimes we focus on just one area. So if someone has a low functioning thyroid, then often the attention is paid to the thyroid gland. But I just want you to keep in mind that there are other areas, other endocrine glands that will also be affected. And of course, we'll talk about how we can support these three glands for overall hormonal balance. So I added this slide in because I just want to illustrate that balancing our hormones is complex. There's no easy solution. We'll definitely talk about different strategies, but I want you to appreciate that our hormones are interconnected. We do have our basic hormones, which I'm sure you're familiar with: estrogen, progesterone, cortisol. But then there's the active forms and the metabolites of these hormones, which also play a role in managing and maintaining our hormone balance and impacting how we feel on an everyday basis. So it's just not about the basic hormones. There's other factors in play. There's the other hormone metabolites coming into play when it comes to hormone balance. And we will talk about, especially when we talk about estrogen, we'll talk about the different estrogen metabolites as well. When it comes to hormone testing, of course, this is an important step in assessing what is going on with your hormones. There's different tests available, blood tests, saliva, urine tests. So I encourage you to speak with your healthcare provider, with your naturopathic doctor, to see what type of testing is available for you to get a better idea of what your hormones are doing. And there's definitely different factors that will impact our hormonal health and the balance of the OAT axis. And we'll talk a little bit more about these as we go along in the presentation. But just sort of as a brief overview, we definitely know not eating well, following an unhealthy diet that's high in processed foods and deficient in important nutrients will contribute to a hormone imbalance. We need these nutrients, macronutrients, micronutrients in terms of supporting our hormone production and hormone conversions, okay? Sedentary lifestyle, so lots of sitting, lying down will have an impact, as will over-exercising. I'm sure you can appreciate the role that stress has on our overall health, and especially when it comes to hormones. It definitely has an impact. And other factors like sleep deprivation, age-related changes. So as we get older and there's a decline in certain hormones, that will definitely have an impact. The chemicals in the food that we eat and traditional personal care products will also influence our hormones. And then other areas such as our gut function, genetics, and inflammation will also play a role. And what happens when our hormones are not in balance? And there is this disruption of the OAT axis where the ovaries, adrenal gland, and thyroid are not functioning to their optimal potential. Well, I'm sure you're experiencing some of these symptoms. Maybe that's why you're here tonight. But definitely people will notice just a change in their overall energy level, feeling fatigued, even waking up in the morning, feeling tired, and getting drops throughout the day, definitely changes in moods, which can take place anywhere from anxiety, nervousness, irritability, and sadness, difficulty falling or staying asleep, difficulty coping as well, where you just feel like everything is overwhelming and it's difficult to manage even the simplest tasks. Other symptoms can include acne, hair loss, dry skin, concerns with headaches, sugar cravings, even salt and caffeine cravings also come into play here. And then other concerns like intolerance to cold, irregular menstrual cycles, PMS, weight gain, muscle pain, overall body pain can take place, changes in libido. And I know one thing that definitely comes into play, especially as we get older, is this just brain fog, cloudiness in our thinking, not able to focus and having poor concentration. So what can we do about it? How can we support the OAT axis and overcome some of these symptoms that we might be experiencing? So I'm going to actually focus in on each endocrine gland. We'll start with the ovaries, and then I'll lead into the adrenal glands and thyroid gland, and definitely, provide you some tips. We'll also talk at the end about supporting the perimenopause and menopause stages as well. So let's start with the ovaries. So as I mentioned, this is an important endocrine gland. It is responsible for producing and secreting reproductive hormones like estrogen, progesterone, and testosterone. There are three types of estrogens. They are more common at different stages of life, whether it's during our reproductive years, which is the case with estradiol. Estrone is more common after menopause, and estriol more common during pregnancy. Estrogen balance is essential, and we do need estrogen. It's very important in terms of supporting our reproduction, our bone health, our brain health, our mood, our cardiovascular health, and our breast health. And as we reach perimenopause and menopause and those estrogen levels decline, we know there are changes in these areas of health. So maintaining estrogen balance is very, very important. Unfortunately, we're being exposed to, environmental estrogens. We're having, more inappropriate estrogen exposure, which is contributing to some health concerns that we're even facing, during our reproductive years. So this diagram here just illustrates the different types of estrogen in the body. And as I mentioned before, hormones are broken down into metabolites, and estrogen is one of those hormones where that takes place. So you can see here the different estrogens are broken down into different metabolites, such as 2-hydroxyestrone, 4-hydroxyestrone, and 16-hydroxyestrone. And some of these metabolites are protective, they're beneficial. Others are harmful, and we want to reduce, the level of these metabolites in the body. The amount of metabolites produced really depends on different factors. So genetics plays a role. The liver and the gut are involved in metabolism of estrogen. So the health of the liver and the gut is very important when we talk about estrogen metabolism. And our estrogen exposure. So not only are we producing estrogen internally, but we're also exposed to estrogens through our environment. And so you might have heard the saying, we're living in a sea of estrogens. What does this mean? Well, unfortunately, we're being exposed to a number of synthetic estrogens, which is also contributing to our estrogen balance. On average, women are exposed to around 515 synthetic chemicals every day, which is disrupting our estrogen balance. These are known as xenoestrogens, so they mimic natural estrogen, but they're not produced by the body. And unfortunately, these synthetic estrogens are binding to our estrogen receptors. So where do we find these xenoestrogens? Our water supply, our foods, especially foods that are, have high quantities of pesticides. Pesticides act as xenoestrogens. Plastics are a source of xenoestrogens. Traditional household cleaners and personal care products, and even medications such as synthetic hormones. So here you'll see the environmental working groups Dirty Dozen and Clean 15 lists. So of course, the Dirty Dozen being the foods that have the highest amount of pesticides. So we really want to minimize our consumption of these foods in order to minimize, our pesticide exposure and ultimately reduce the xenoestrogen exposure as well. So what happens with this estrogen imbalance? Well, our exposure to these xenoestrogens will definitely influence our overall metabolism and balance, estrogen metabolism and balance. And these estrogens are acting like endocrine disruptors. And this is creating a scenario known as estrogen dominance. So basically, we have this imbalance of estrogen, an imbalance of our protective or good estrogen compared to that harmful estrogen, and even in relation to having low progesterone levels, okay? So as I mentioned, the liver and the gut play a really big role here in terms of supporting estrogen metabolism. So we're going to definitely look at how we can support those areas. And then you can just see here just some signs and symptoms related to estrogen dominance. So menstrual irregularities, acne, breast tenderness, weight gain, brain fog, low libido, mood swings, migraines, and a number of other conditions listed there as well. Estrogen dominance does not only impact women, it can also impact men. And our kids are also exposed to these synthetic estrogens as well. So we want to also keep in mind their exposure and definitely trying to minimize what we're in contact with on a daily basis. So how can we support our estrogen balance and metabolism? Well, definitely starting with supporting the liver and supporting or reducing our exposure to these synthetic estrogens is very, very important. So definitely trying to avoid harmful chemicals, pesticides. So, choose organic when you can. Replace traditional house cleaning products with more healthier alternatives, clean products, even, your personal care products, so lotions, shampoos, etc. Making switch to more cleaner products is very important. Replacing any plastic products that you use, maybe plastic food storage containers, plastic water bottles, use glass or stainless steel in place of that. That's all very important. To support the liver, starting your day with a cup of warm water with lemon is really great. Lemon is very nourishing to the liver and can support the enzymes in the liver and detoxification processes. Moving your body, dry skin brushing before a shower, practicing hydrotherapy. So that just means, ideally in a shower, doing 3 minutes of warm water followed by 1 minute of cool water, alternating that a few times, always ending your shower with a cool temperature water. I know that's not always enjoyable in the wintertime, but that's really great in terms of supporting our detoxification, our liver, and our lymphatic system. And include superfoods like broccoli, kale, cabbage, etc. These foods have really important compounds that will actually promote healthier metabolism of our estrogens and go a long way in terms of supporting the production of our good estrogen metabolites and reducing the production of those harmful estrogen metabolites. And then when it comes to natural health products, there are a number to choose from. I have one example here, the EstroSense from Women's Sense, but definitely looking at nutrients and herbs that will support liver health and healthy estrogen metabolism. So that includes, ingredients such as indole 3-carbinol, sulforaphane, milk thistle is a really great liver supporting herb, turmeric, all fantastic in terms of supporting liver detoxification and also supporting the production again of those good estrogen metabolites and reducing the amount of those harmful estrogen metabolites that we might be producing. So when you do that, you can go a long way in terms of promoting healthier estrogen balance and really helping to reduce some of those estrogen dominant symptoms that we took a look at previously. And I just wanted to mention this trial that was published in 2022. So it actually looked at the use of EstroSense in premenopausal women, and it measured those estrogen metabolites, so the 2-hydroxyestrone and 16-alpha hydroxyestrone ratio, which is an important biomarker for breast cancer. So with the participants, what they did was they either used EstroSense for 3 months and then used a placebo, and then they switched around. The placebo group that started with the placebo then went on to use the EstroSense. And what they found was that using the EstroSense was important in terms of improving those good estrogen metabolites, that 2-hydroxyestrone. And of course, that was important in terms of lowering the risk of breast cancer. So when you're able to modify those estrogen metabolites, again, it can have an important impact in terms of supporting our good estrogens and our estrogen balance. And another important area here is supporting the gut. So there's an important connection between our hormones and our gut. Our gut is connected to everything. So I think any topic that we probably discuss will really emphasize the importance of the gut. But the gut does have the estrobolome. And this is a collection of microbes in the gut, so good bacteria in the gut that specifically metabolizes and excretes estrogen metabolites. So we have an unhealthy estrobolome that can lead to high levels of an enzyme called beta glucuronidase. And that is an enzyme that can actually deconjugate estrogen. So estrogen will be conjugated in order to be eliminated from the body. But this enzyme will reverse that process, put it back into an active form where it's then reabsorbed into the bloodstream. We really don't want that happening. When it's reabsorbed, it will go back and bind to the estrogen receptors and impact our estrogen balance. So we definitely want to look at supporting the estrobolome, and we can do that with many of the things that we consider for supporting the gut, like prebiotics, like probiotic supplements, and lots of fiber. Fiber is really important, not just in terms of regulating bowel movements, but plays an important role, of course, in terms of supporting our microbiota and having, a number of other benefits. I can see there's lots of questions coming in, so I'll just have to wait till I'm done to address all of them. I hope you understand. Okay, let's move on to supporting the adrenal glands. So the adrenal glands are these hat-shaped glands that sit on top of our kidneys. Not sure if you can I think I can move this down a little bit. See this little diagram that sit on top of our kidneys. They're often called our stress glands, and they do produce really important hormones like estrogen, progesterone, cortisol, one of our major stress hormones. And as the stress glands, they do help us adapt to stress. There are generally 3 to 4 stages of stress. I just listed the 3 typical ones. So the alarm stage is when we're first introduced to a stressor. We have that fight flight response that takes place. Our breath quickens, our heart rate increases, our blood pressure increases, just so that we can deal with a stress that presents itself to us. But if a stress becomes prolonged, then our body will go into the resistance stage where it's trying to deal with the stress and manage what's taking place. So there we'll see, definitely increases in cortisol levels taking place. The resistance stage is a really key stage where we really should be supporting our bodies as it's dealing with this ongoing stress. But if we don't, if we kind of neglect what our body is trying to tell us, then we'll definitely go into the exhaustion stage where, our cortisol levels will decline and we'll tank out, we'll feel exhausted. That will predispose us to a number of illnesses and health conditions. So constant stress can definitely impact our adrenal health. And I know, stress, unfortunately, has become a way of life, a part of our lives, unfortunately. And we can't always, get rid of that stress, unfortunately, but we can definitely look at how we deal with it and how we are supporting our bodies. So the resistance stage, so that second stage, can lead to adrenal dysfunction. Some people call this adrenal fatigue. Some people call it an HPA axis dysfunction, so different names for it. I like to say that the adrenals are kind of tired, and we really need to support how we are dealing with the stress that's in our lives. So different things that you might experience in this stage, and I mentioned these when I talked about some of the consequences of a hormonal imbalance. So this feeling of being overwhelmed and unable to cope, cravings for salt, sugar, coffee, just, to kind of give you that boost or short boost of energy that unfortunately doesn't last. Sleep disturbances. So whether that's, difficulty falling asleep or waking up during the evening, headaches, dizziness, changes in body temperature, having cold hands and feet, more inflammation, pain, weight gain, especially around the belly, anxiety, irritability can also take place. And then, as I mentioned, this exhaustion stage, if, we're not supporting the body when it's dealing with long-term stress, then that can predispose us to a number of health conditions. Again, mood, reproductive concerns, cardiovascular concerns, a weakened immune system, weight gain, concerns with the digestion can all take place. So you can get cortisol levels tested, through blood, saliva, or urine. This is an option. One little neat test that's available if you'd like to take a look on the Women's Sense website is the adrenal stress test. So there's a number of questions or statements that are available, and you just need to rate each one. So 1 for if you've had the issue in the past, 2 for if it occurs occasionally, 3 if it happens often, 4 if it occurs frequently. Once you get your total score at the end of the quiz, you can take that total score and see where you kind of land in terms of supporting your adrenal glands. And over 100, a score of over 100, indicates that you're kind of in that exhaustion phase and you definitely need to support your adrenals. But even earlier, there's definitely space and opportunity to support your overall adrenal health. So a neat test if you'd like to take that to get some more information on where you're at with respect to adrenal health. Okay, so how can we restore the adrenal glands? What are some, easy tips that you can even start tomorrow to support your adrenals? So eating regularly is very, very important. I know when we are under stress, we feel like we don't have enough time to prep food and get regular meals in, but it's very, very important. It's a really important step in terms of balancing our blood sugar levels, which is really key overall in terms of supporting our hormones and supporting cortisol levels. So including healthy proteins is important. Healthy fats, fiber-rich foods, all really key. And really trying to, if you can, make an effort to decrease caffeine intake, alcohol, refined carbohydrates. Unfortunately, these are more stimulating, not nourishing at all, and will not play a role in terms of supporting the body. So where you can, really high quality foods, whole foods is what you need to do. Engaging in regular physical movement and relaxation exercises. If you are feeling very tired and, just even feel like you don't have the energy to do any physical movement, sometimes this, stretching is great. Simple stretches, going for a short walk can go a long way, climbing a set of stairs. These can all have an impact in terms of just getting your body moving. Understanding how you perceive stress. So this is a big thing, just knowing how we look at a particular situation definitely influences how we react to stress in our lives. So taking a moment to understand what is your initial reaction to a stress that happens in your life, and is there anything that you can do to change that? Getting a good night's rest. So this is big for me. For myself and for my patients, I always try to advocate, appropriate sleep routine, really trying to get to bed at the same time each night, having, different relaxation techniques in place before you go to bed if you know you're going to have difficulty falling asleep, and making sure that you sleep in a nice dark, cool, and quiet room. All very, very important. And then when we are under stress, our body uses up a number of nutrients, and then we are at risk of being deficient in these key nutrients. And that can include our B vitamins, vitamin C, magnesium, of course, vitamin D, omega is very, very important, probiotics to support the gut. So these nutrients are very important in terms of supporting the adrenal glands, supporting our energy levels, and supporting our digestion as well. And an additional strategy you can take a look at is using adaptogenic herbs. So adaptogen herbs are useful in supporting cortisol levels. So balancing out cortisol levels, reducing any high levels of cortisol, and really helping the body adapt or cope with stress and reducing some of those physical and mental symptoms that can take place when we're dealing with stress over the long term. So some great examples of adaptogenic herbs include rhodiola, ginseng, ashwagandha, one of my favorites, maca, also really great. As an example here, there's the Adrena Sense product. So that's a combination of 5 different adaptogenic herbs, which will help in terms of supporting cortisol, supporting energy levels, and helping to combat fatigue when we are dealing with stress in our lives. Okay, and the next area we'll take a look at is the thyroid. So the thyroid is very important, has a number of important functions for the body. It helps to regulate our metabolism and temperature. It's important for supporting our skin and hair, our digestion, our cardiovascular health, our muscle function, and other areas that you can see here. Studies show that about 1 in 10 Canadians suffer from a thyroid condition, and as many as about 50% are not diagnosed. There's differences definitely in terms of how we interpret thyroid testing, and I think that might play a role in terms of, some thyroid cases being missed. But what's important to know is that the thyroid gland is responsible for secreting 2 specific thyroid hormones, T4 and T3. This is stimulated by a hormone from the brain, TSH. And the body will convert T4 to T3, and T3 is sort of the more active form of the thyroid hormones, but T4 is more abundant. If you do have a low functioning thyroid, chances are you are on Synthroid. This is a T4 hormone only. So sometimes people don't always feel the best when they're on Synthroid only, and that's because we need to take steps to improve the conversion of T4 to T3, and we'll talk about different nutrients that can help that. I also want you to keep in mind that the health of your adrenals is very important when it comes to looking at your thyroid health. And it really just goes back to that relationship that I talked about at the beginning. So if there's a problem with respect to the thyroid, that will impact the adrenal glands. And, any concerns with adrenal health will also impact the thyroid. So again, we often, maybe focus on one area, but it really is important to focus on the different contributing factors. And keeping in mind cortisol, or one of our main stress hormones, can actually inactivate T3, or that active thyroid hormone. And in doing so will definitely lead to thyroid health concerns. Oftentimes when we're assessed for our thyroid health, it's usually TSH, maybe T4 that are tested, but there are other thyroid tests that are listed there that ideally should be investigated to see what is really going on with the thyroid. I know that can be a challenge sometimes, getting some health practitioners to test all of these assessments, but it really is ideal, excuse me, in terms of really figuring out what's going on with your thyroid. Okay, and then when it comes to low thyroid, these are typical symptoms and complications that can come about. So low energy, weight gain and difficulty losing weight, cold intolerance, hair loss, dry skin, constipation, depression, and infertility can take place. I wanted to add this diagram in here. I hope you can make it out. There's the reference there in case you want to look at it on your own. But I thought it was interesting and could illustrate better to everyone, what factors can cause a problem to the thyroid and what factors are beneficial. So we see on the left, the red are factors that can inhibit thyroid hormone production. Stress is on there, infections, different medications, our exposure to fluoride, different toxins as well, different heavy metals may play a role. And then the factors that can contribute to proper thyroid hormone production. So really important in terms of ensuring we're not deficient in some of these nutrients like iron, iodine, zinc, selenium, some of our B vitamins, vitamin D. Again, T4 needs to get converted to T3. So there's some nutrients that you need there in order for that to take place. And selenium and zinc are examples of that. And then just improving the cell's response or sensitivity to thyroid hormones. Vitamin A, exercise, and zinc are really important there. So just wanted to include that just to kind of give you a bigger picture of some of the factors that can influence thyroid health. So when it comes to supporting the thyroid gland, and especially in cases of low thyroid, definitely look at supporting the adrenal glands. So everything we talked about with respect to adrenal health is very important. Your whole foods diet, regular exercise, managing your stress, including foods rich in iodine. Iodine is important in terms of helping with thyroid hormone production. You don't want to do too much iodine. So food sources are really great in terms of supporting iodine levels. Avoiding GMO soy. Large amounts of soy can block the activity of one of the thyroid enzymes and has been linked to autoimmune thyroiditis. So if you do consume soy, I'd say just limited amounts. There's also thought that raw goitrogen, so raw broccoli, kale, cabbage, cauliflower, may also impact thyroid hormone production and conversion. So if this applies to you, then limiting those foods, you can eat them in a cooked form, that's no problem, but in a raw form may not be beneficial for some people. Consuming healthy fats, especially our omegas, have anti-inflammatory properties. This is really important if you are suffering from an autoimmune thyroid condition. Reducing levels of gluten and dairy and avoiding toxins like fluoride and bromine. They have been shown to prevent the thyroid receptors from collecting iodine, which again is needed for the production of thyroid hormones. And then looking at supportive herbs and nutrients, and there's some listed there. And again, I mentioned before, so nutrients like iron, iodine, manganese, zinc, selenium, and others that will help to support thyroid hormone production, as well as conversion to support overall thyroid gland health. Okay. And then let's go through this section just for respect to supporting perimenopause and menopause. And then we'll try to get to all of your questions. There's quite a few there. And we'll see what you're asking. Okay. So perimenopause and menopause. So let's distinguish between the two. So perimenopause refers to the 10 to 15 years leading up to menopause. So this can start in our 30s or 40s, and of course, lead up to menopause, which is, where we have not had a menstrual cycle for 1 year. Okay, so you can go through this perimenopause stage, skip a couple of cycles, but then get another one. It's when you've had no cycle for a year, that's when you are officially in menopause. Both times, stages, definitely bring a number of symptoms and changes that, sometimes we're just really not aware the impact that is taking place. But definitely changes in energy level can take place, mood swings, hot flashes, vaginal dryness, insomnia, lots of things that we've already mentioned, which can take place, with adrenal health, thyroid health concerns, and here, of course, in perimenopause and menopause taking place, and a few others listed there. So, definitely it's this, changing hormones, decline in estrogen, progesterone, testosterone that takes place during this time. You can see in this diagram on the right, what our hormones are like during our premenopause stage. In the middle, we have that perimenopause stage. And then, postmenopause, there's this definite decline in these key hormones that are supporting so many areas of our health. During this time as well, the adrenal glands actually become the primary hormone source when the ovaries start to shut down after menopause. So just, that's really important because we talked about supporting adrenal health, and it becomes so key during perimenopause and menopause that we do that because it does then become the primary hormone source during this time. Some women will suffer, terrible symptoms because their adrenal glands are exhausted before they hit menopause and are unable to produce hormones. And an important question to ask, is it menopause or is it thyroid? So and you probably realized that when I was saying those symptoms in the previous slide, a lot of the symptoms that can come about in menopause are very similar to thyroid or very similar to adrenal dysfunction as well. Sometimes we're told we're in menopause, but and especially based on our age, but it really is important to be assessed appropriately to, see what is going on with the thyroid gland, et cetera, to see if there's, anything else taking place. So what can we do? Some of the same points come about that we talked about previously. So following a whole foods diet, so good quality proteins or healthy fats, fiber, a rainbow of fresh fruits and vegetables, including those cruciferous vegetables, which will support estrogen metabolism. Your protein goal in general, especially if you're active, should be anywhere from 1.2 to 1.5 grams per kilogram of body weight. And your fiber goal should be around 25 to 30 grams per day to support, overall gut function. And we know that fiber is also important in terms of colon cancer prevention. If you find your diet isn't always great, then consider a broad spectrum multivitamin mineral formula with whole food sources is a great step. It helps to really, fill in some of those nutritional gaps that you might be facing if you're not always able to eat well. Phytoestrogens are also important. So flax seeds, oats, lentils, these are great foods to help support healthy estrogen levels, minimizing your intake of caffeine, sugar, alcohol, and reducing your exposure to different toxins, pesticides, etc. Also very key. Other things to consider, of course, always regular movement, managing stress, trying to get your best sleep. Seed cycling, some people like to do this. Even I sometimes do this, not during perimenopause and menopause, but earlier on. So, balancing omega-3 fatty acids and omega-6 fatty acids on different phases of the cycle. This is helpful in terms of supporting our hormones during different phases. If you are interested in knowing more about bioidentical hormone therapy, that is not what we're going to talk about tonight. I think that's a totally different discussion, definitely a different webinar that can take place. But if you are interested in this, because there is more talk about it, there is more support about it, then I definitely encourage you to discuss this with your healthcare provider or search for a certified menopause practitioner who can help you in this regard. There are herbs that can help with respect to menopausal symptoms, ones such as black cohosh, chasteberry, donquay, maca, sage. Those are all great considerations as well. Okay. So some of the products that I spoke about tonight come from the Women's Sense line. I just wanted to mention that Women's Sense is a proud supporter of the Canadian Women's Foundation. The Canadian Women's Foundation is a leader in the movement for gender equality in Canada. They have a number of programs available across the country that help to support women, girls, and gender diverse people to move out of violence, out of poverty, and into roles of confidence and leadership. And $5 from the sale of each of the Women's Sense bonus bottles is actually donated to the Canadian Women's Foundation. And Women's Sense has definitely been able to provide some significant donations to this organization. And I also wanted to just end with just some words on, supplement testing, quality testing. So some of the products that I mentioned tonight or others that you might find in a health food store might have this iSura seal of approval on them. So iSura is an independent, not-for-profit testing assurance program. They look at over 800 contaminants in products, use a lot of state-of-the-art testing procedures to test for different contaminants, pesticides, heavy metals, GMOs, etc. And if something does not pass through iSura testing, it's never included in a product. So if you have this iSura seal, that you see on a supplement, then those products are non-GMO, contaminant-free, adulterant-free, authenticated, and accurately labeled. Okay, so that concludes my presentation for this evening. So thank you so much for joining. If you want more information, you can definitely reach out to Women's Sense. I've also included my Instagram handle there if you'd like to reach out to me as well. Dave, thank you so much for joining us tonight. Okay, so now I'm gonna go to Q&A. Something. Okay. There's a lot of questions here, everyone. Let's see. Okay, so there's just a question in terms of low estrogen associated with cramping during menstruation. This is possible. There's other reasons as well, but this imbalance of estrogen can definitely contribute to irregular cycles. And what can cause intense cramping? So that's a big question. It can be diet related, especially if there's a lot of inflammation taking place in the body. That can definitely increase cramping. An imbalance of hormones can also do that. Nutrient deficiencies may also play a role. So lots of factors that can play there. So question about getting there. Hopefully the recording worked for tonight. So hopefully that will be available to you if anyone had concerns with this evening. Working with women with fibroids, I do, as other naturopathic doctors do. So if you're interested in a referral, then can definitely reach out to me on Instagram and I can help you connect with someone. There's a question on lowering estrogen dominance. I think I went through that, so hopefully that's okay. Can limes be used in substitute for lemons? Usually lemons. You can try limes, but it's usually lemons that are best. Turmeric is also great. Green tea for liver support, so you can also look at those as other options. Are bitter foods beneficial for estrogen metabolism? I always think of bitter foods more in terms of supporting digestion, which would support the gut. So maybe in that way would be beneficial for estrogen metabolism. Is kimchi great for PCOS? So PCOS we didn't talk about tonight. Again, that's another big topic. So for PCOS, you are looking at insulin sensitivity, supporting the gut, the role of inflammation. So kimchi would be great in terms of supporting the gut in that respect for PCOS. So, and then there's just a comment here. All the major antioxidants ended up on the dirty list. There are key foods on the dirty list. Unfortunately, a lot of the foods that my kids like as well, I know. Yeah, and some of the foods that we really like to enjoy, we feel are healthy, are on that dirty list. So in that respect, if you can, buy those foods that are organic. I know sometimes we definitely have budgets and that doesn't always work. So cleaning that produce as best as you can also help. There will be a replay, there will be a recording available for the presentation as long as it worked. Is rheumatoid arthritis connected to hormone imbalance or hypothyroidism? There is a connection. That rheumatoid arthritis does have an inflammatory component, autoimmune component, so that can all come into play. Can low estrogen progesterone cause hair loss? Yes. Can intermittent fasting be helpful or harmful? It can be helpful if you're doing it right. So just make sure if you're not familiar with it, definitely work with someone that can guide you appropriately. Is there a good product for hot flash control? So some of the herbs that I mentioned before, so sage is great, maca, black cohosh, those could be helpful for hot flash control. And supplements for PMS, lots. So again, we're looking at all those areas supporting estrogen, progesterone, supporting the adrenal glands. So your good fats, your B vitamins, especially B6, herbs like chasteberry, also great for PMS. What is the ideal TSH number? So general reference range, lab range can go up to 5, but the ideal is between 1 and 2. Can thyroid antibodies be lowered? So here, yeah, you have to take an anti-inflammatory perspective, support the immune system. Um, there's a comment just in terms of doing gluten-free and nothing's changed. So I think you just have to look at other strategies. Can adrenal fatigue reflect low estrogen? So yes, there are those imbalances in hormones that can take place. So definitely. Um, so just in terms of some of the supplements and cautions, so just there, best to just read the cautions on each of the product labels in terms of if there's any cautions or contraindications for any conditions or medications that you might be on. Okay, and then there's a question just in terms of if urine and saliva hormone testing are reliable. Yes, I would take it into consideration with what you're experiencing, but yeah, definitely can provide some answers. And is it okay to take melatonin for sleep long term? Um, you can't. So the idea here, melatonin definitely declines as we get older. So using, low dose is okay over a long period of time. But I always like to see what's kind of going on and what might be triggering that insomnia. So just taking those other factors into consideration are important. So, all right, there's 99 comments here. Sorry, guys, I'm just trying to so question in terms of EstraSense being safe to take with thyroid medication. Yeah, just double check the label, but I think that's fine. Is progesterone dominance a correlation of endocrine imbalance? Yes, definitely. It's another hormonal imbalance that can take place. Um, there's just a question in terms of recommending chasteberry or DIM. So they do play different roles. DIM will play a role in terms of supporting our estrogen metabolism. And chasteberry in terms of supporting luteinizing hormone, progesterone, estrogen. So they will play different roles and both can be supportive for overall hormone health. And yes, I do like Vitex for supporting hormone health. Some of you are helping answer the question. I appreciate that. It's very nice. There's a question just in terms of the stress stages and if cortisol is high in the second stage. So yes, it can be high. There can also be highs and lows that take place. So Dutch test will definitely look at those hormone metabolites. So if you are interested in knowing then that information, then that will give you a better picture of what's going on. What type of magnesium? Depends on how you react to magnesium, but I usually go with magnesium citrate or bisglycinate. And for brain support, I usually suggest 3 and 8. Okay. Trying to Okay. You guys are kind of chatting as well. I'm just trying to filter through. Okay, so I think that's I know I might have missed some, but you can feel free to reach out to me on Instagram if there's something that I did not get to. And I can just help lead you in the right direction in terms of getting the support that you need. Just gonna quickly just do a final check. Okay. I think that's it. Thank you for all the thank yous. And yeah, feel free to reach out to me on Instagram if you have any further questions. And thank you so much for your time tonight.